everybody. As always, I'm super excited to meet somebody new and fantastic with so much to share. And I want to introduce you to Cleo. She is the owner-operator of Cleo Amelia, which is a fantastic spa, medical spa, what would we call that?
Wellness boutique.
Oh my God, I love that. Fantastic wellness boutique located on El Paseo. So I'm excited for her to tell you a little bit about what that means because I've never heard of a wellness boutique before. So tell us a little bit about it.
Sure. Well, it started off with me just doing acupuncture and herbal medicine and some skincare stuff, but as my business grew and expanded, I took on more modalities. I became a functional medicine practitioner, so I sort of changed it to wellness boutique, so it's more encompassing versus just an acupuncture clinic.
Okay, perfect. And now I've heard of acupuncture. I have not heard of the last thing that you said, functional
medicine.
Functional medicine. Okay, so tell me a little bit about what that means.
So functional medicine is root cause medicine.
Okay.
So basically, you go to the doctor, they take your blood, and you go in with symptoms like, why else are you there, right? And then they're like, oh, you're fine. Right? You're like, but wait, I'm not fine. I have all these different symptoms.
Right.
They are using very wide reference ranges that are based on the population in your area, which, here is an older population. Many people who go to the doctor are sick. Functional medicine takes reference ranges and makes them more optimal. We close that gap a little bit.
Okay.
So we're able to spot things that conventional doctors can't. We're able to prevent things before they happen. And we just view lab work in a way that's sort of like a puzzle. Like a general blood panel can tell us a lot of where to look. Like, are you experiencing gut issues or some heavy metal toxicity or mold toxicity or Lyme disease or chronic autoimmune conditions, things like that.
Okay.
And then we order more extensive blood work or urinary tests or stool testing that really dive deeper into
based on what you found the first round. So you are taking samples of somebody's blood. You're not just, I'm feeling you, and it's not just.
No, it's not just it's not energy work
at
all.
Okay.
Really.
Okay.
Of course, I do have a background in acupuncture and Chinese medicine,
which I love.
So I do incorporate all of that and the energy side of it into functional medicine. But functional medicine is very data driven. Like, we are looking at labs, and I'm obviously going based on what you're telling me too. But we are diving deeper into actual data that's going on in your body.
Okay, so when you have, let's say you have somebody and they come in and you determine it's maybe a blood pressure issue or there's something like that, how do you help them work through that?
So through everything, we look at diet, we look at lifestyle, we look at stress is a huge one. How are you sleeping? And then natural supplements.
Okay.
So I use all different kinds of herbs and vitamins and hormone replacement therapy. And
okay, so you create like a plan for them.
Yeah.
Okay, and basically walk them through that.
Right.
Okay. So tell me about a situation with some sort of, I don't want to call it ailment or illness, but that is actually common to a lot of people, and how you would walk them through. Choose one that you see often.
So I think there's a big misconception about autoimmune diseases.
Okay.
So I guess that's where I'll start. So a lot of people will come in and they're like, I had a positive autoimmune test and they've diagnosed me with this autoimmune disease, right? But at the end of the day, an autoimmune disease name is just that. It's just a name.
Okay.
It's why is your body attacking itself? Why is your body attacking that tissue? And there's often underlying conditions with that, like, are you celiac, right? Like, can you tolerate gluten? Is that why you're having lupus flares or something like that? Or do you have mold toxicity? That could be a huge autoimmune trigger. What is your toxin load in the body? Stuff like that. Same thing goes with like IBS, for example, like irritable bowel syndrome or irritable bowel disease. Well, why is your bowel irritable?
Right.
That's what we're trying to.
We're not just give you something to,
like a name to hang your hat on, right? Like, we're trying to figure out why you're experiencing that, because any disease name is just a name.
Right. And do you feel that with the data and whatnot, you can use a natural product or something that's herbal or whatnot to cure almost anything that comes in here?
Well, I cannot say cure.
I'm sorry. Yes, please correct me because I know that I'm going to use the wrong word.
It's all right. But yes, I mean, myself, am living proof of that. I used to have psoriatic arthritis, which is an autoimmune condition. I used to have Lyme disease, and I used to suffer a lot when I wasn't in this world. And that's why I got into all of this.
I'm sorry. I'm like,
it's okay.
Okay. So many questions.
And now I don't have any of that. Like my fingers, I was in acupuncture school when I first got diagnosed with psoriatic arthritis. I had nodules, like actual arthritic nodules all over my hands and rashes all over my hands that I didn't even think that I would be able to practice acupuncture because I'd wake up and I couldn't open my hands.
Okay. So I really want to unpack this because as I explained earlier, part of this is, hearing your story as not just what you do, but how you got here. And there's always a reason why we choose what we're passionate about and choose to give to others, right? Which is essentially what you're doing. So you are young and you had arthritis and I look at your hands right now and I would never ever guess that.
Yeah, but they literally had like huge nodules coming off of them.
So you said that you were going into, tell me how you got all around to doing that. Like, was it the arthritis or you were already in the acupuncture? How did that work?
I feel like it was my whole life. So I grew up in a very traumatic household. And I feel like, a lot of trauma has to do with how people develop health issues later down the road. I grew up around smokers, I had asthma, I had a lot of skin issues, I had a lot of food allergies, and then in my early 20s, like late teens, I had a substance abuse problem, and so stack that all together, and I started developing health issues.
Of course.
Right? Yeah.
Right.
And it started with, not the arthritis and not the rashes, but more subtle cues, like really bad immune system problems. Like my skin was a mess, still had a lot of eczema. I would get like giant cold sores all the time for no reason, like literally 2 a month.
And you have beautiful skin.
Thank you.
Yeah.
That was a work in progress. And so when that was all going on, the first integrative health thing that I ever tried was acupuncture and Chinese medicine.
Okay.
So I was like, nothing's working. I don't want to take these medications. I grew up with a mom who was addicted to prescription drugs. I was very against it, right? I was like, I can't continue to party my life away. Like, obviously, it's not doing anything for me. And so I sought out an acupuncturist in Chicago, where I'm from, and it worked for me. Like, literally, after a couple months of seeing this person, I no longer had any of the immune issues that I was experiencing for years. Like I never even got a cold sore again.
Okay. And so that was like the catalyst, I want to do this for other people. I want to learn about it.
Yeah.
Okay.
Yep.
So you have a lot of diplomas and, records of your schooling up here in your studio. So clearly you have learned a lot about this particular field.
Yeah.
I just feel like I've known people who are young, who have issues with their hands and whatnot. What were the processes for you to kind of just get through that? Was it only the acupuncture? Or did you change your diet? Was it a whole lifestyle thing?
Yeah. So I didn't have that until I actually started acupuncture school.
Okay.
So I saw this acupuncturist. She helped me with all of my immune issues. I actually started teaching yoga for a while. That was kind of like my first step into the health and wellness space. And then after a while, I was like, okay, I can't make enough money teaching yoga. Honestly, you can't. And I don't want to do this for the rest of my life. So I was like, what's acupuncture school entail? So I just took the leap. You don't really know what you're getting into. Like nobody really knows about acupuncture unless you go to school for it. And you literally take your first class and you're like, what the fuck is this? But you're also like, I love this and I don't want to stop learning this weird medicine. It is kind of weird. And probably it's a 5-year doctorate degree, so it's a big commitment. Probably the second year that I was in it, I don't know if it was the stress or lack of sleep or just studying all the time, but that's when I started to develop the arthritis in my hands. And so I sought out help both from a Western and an integrative standpoint, like a naturopath, functional medicine practitioner, also a rheumatologist and Western medical care. And no one was really able to help me. I never really saw results with it. The care was also you go in, they see you, and they're like, okay, here's your treatment plan. Bye. See you in 6 months. And that's just not me. I'm like, well, wait.
I have questions. I want to know.
Yeah, I want to know what's going on. Right. You're not really helping me. This supplement isn't going to change my life.
Right.
There's other factors that go into it. What about my mom who took all the prescription drugs? How does that play into all this, right? So basically, I was introduced to functional medicine and naturopathic medicine when I was in school. And I sort of made it a mission that when I was done with school, I was going to combine the two.
Okay.
Hence all of the certificates and stuff.
Yeah, right. And how long ago was that? When did you, is it, I know you've been here for 3 years.
Yeah.
Is that how long you've been practicing this specifically?
Yeah.
Okay, great.
Yeah, so I graduated December 2020.
Okay. Oh, wow.
Yeah.
And you decided to...
I moved here a day after from Chicago. Literally graduated and moved here the day after. And I found this space even before I took my boards exams in California, and I was like, whatever, I'm just going to go for it. The issue with the board exams is if you don't pass, you have to wait 6 months. So if I failed, I would be paying rent on an office
that
I cannot use.
Okay, so talk about motivation.
There was no way I could fail.
Yeah. So how did you choose here?
Well, that was my husband's choosing.
Okay.
He had been coming here for a while since he was a kid.
Sure.
Yeah.
And it is a beautiful place.
Yeah.
I agree. Yeah. Right. So in 20, you are going to take your boards. You have your space, and you're like, I'm going to do this. It's COVID.
Yeah.
How did you start to build a business during a time when people can't? I mean, I can't even form the question. Like, how did that work?
I'm not sure, to be honest. Like, people ask me this a lot, and I try to like look back on what was the big thing that helped me grow my business, especially in a time when, you know, COVID was going on, things were a little weird, and in a place where I didn't know anybody. Like, I didn't know a soul.
Right.
And even when I moved here, I was studying for boards, so it's not like I had a social life.
And I'm pretty sure holistic medicine is not like a big thing here.
Yeah.
You're probably one of the handful of people.
Yeah.
So creating, I mean, that's amazing. So continue. I'm sorry.
And I don't know. I think it was just like my persistence.
Yeah.
Like I would go and I would sit at a chiropractor's office and like talk to all his patients and get to know them. You know, I would do that. Or I would go and work with like an esthetician and I would like meet her patients. I would go practice at like local yoga studios and I'd get to know people in the community. And that's not like me. Like, I don't like crowds. I'm very introverted, and I have definitely, that has been my biggest challenge, is coming out of that bubble.
Right.
Especially coming from like the Midwest to the West Coast. It's very different attitudes.
Sure.
So it's just kind of adjusting to that. But yeah, I just think putting yourself out there and getting to know as many people as you can helps, and it's sort of a domino effect from there.
Yeah, I mean, so my thought that I had was like, I know how you did it. You did it because you weren't going to not do it.
Yeah.
You did it because you did what you had to do in order for it to work.
Yeah.
And you got outside of your comfort zone and did all the things you don't really like
100%.
to do. You know, and those are all the things that people are really scared of. Not just introverts, but extroverts too. It's like the hardest thing, and I had this thought about myself yesterday about something completely separate, but when you do something new, when you try something new and expand to something new and you fail at it, like that's almost, that idea that you might is almost the only thing that holds you back.
Yeah.
And if you just put that thought out of your head, then it's okay, right? So it's such exercise in your own self, your mind and the way you think. And if you can get through that, then anything works. Anything is possible. And 2020, who's looking... You got masks on, like all of the things, but you're going to go to mask yoga and mask chiropractic. I mean, all of that stuff.
Yeah.
That's really awesome.
I think it's, you know, people are scared of starting their own business, but when you commit to a space and you invest not only your time and finances, obviously, into your own business, you cannot fail. That's like your mindset now. It's like you are not a failure and you're going to do everything in your power to make it work, even if that's like shifting a little bit. You know? I think one of the big things in running a business is like it's trial and error. It's trial and error. Like if something isn't working, then you're reconfiguring it so it does.
Right. Excellent. And so, of course, you've had challenges.
Yeah.
It's not just been a walk in the park.
No.
And here we are 3 years later. How is your business?
Great. It's like really, it's better than I ever imagined.
Congratulations.
Yeah. And one of my goals one day is to definitely teach. You don't learn anything about business in acupuncture school.
Oh.
Nothing at all. Like literally not even how to like, you know, open a QuickBooks account. You know what I mean? Like nothing at all. So there's just a lot of acupuncturists out there that are making like $30,000 to $40,000 a year. It's like our education was like $180,000.
That's so crazy.
You know what I mean?
That's so crazy.
Like wild. And there's just this potential to make so much more money if you know what you're doing, and they just need a little bit of guidance.
Yeah. And that's not just only for acupuncturists. Like, a lot of people don't know how to run a business.
Mm-hmm.
They don't know how to manage their books and their expenses. I mean, real estate agents, they'll have a check that's $30,000. They could have a $50,000 check.
Yeah.
And they could do that 50 times a year.
Yeah.
But if they're not running their operation like a business and accounting for things,
mm-hmm.
they could be 80 and not have any money for retirement.
Right.
So learning how to run a business and doing those things is imperative.
Mm-hmm.
So that would be a great service, not only to your community, but like to anybody who comes in here and is trying to learn your craft. Like, that's an amazing thing. That's like really good.
Yeah, I don't know where it came from. Even my husband says that all the time. He's like, who is this person? Like, how did you, like, I was teaching him QuickBooks today, and he was like, how do you know all of this? And I think think about it, and I was like, I think it comes from my background of, like, my mom wasn't a mom, you know, like, I always had to,
be
myself.
responsible.
She was my friend. Like, I always had to figure out things on my own.
Mm-hmm.
And so this is just one of those things.
And it's interesting. You've mentioned your mom a few times.
Yeah.
And obviously, like, we take everything from when we were younger, like, it's part of us.
Yeah.
And we get to choose how that ends up.
Yeah.
Right? Your mom, it's a learning experience for you. It's a map of what not to do. But it's also, she was your mom.
Yeah.
And you know what I mean? Like, you take what you want. You don't have to be that. You don't have to carry it.
100%.
And it's really, it's an important thing for people to know.
Right.
For sure.
And I think people too have to realize, like, there's good and bad to each and every single person. So what strengths can I take away from my past experiences with not only my mom, but everybody else, you know?
1,000%. I couldn't agree with that more. 100%. What kind of services do you provide here? Like, if somebody was like, I've gone to the doctor a bunch of times, I don't know what else to do.
Mm-hmm.
Like, is it really extensive?
Like, what my services
Yeah.
are?
Well, I mean, like, yeah. Tell me what you provide.
Yeah.
And then tell me some of the common things, or maybe not so common, like, that people come in and I don't know. Like, I would like for people to know that they could get help here and what that looks like.
Yeah. So there's a lot of services that we provide here. I have Dr. Liz, who works and does acupuncture, cosmetic acupuncture, herbal medicine.
Mm-hmm.
And then I still do some acupuncture, herbal medicine, cosmetic acupuncture, microneedling. But for me, that has slowed down a lot since I've started functional medicine.
Yeah.
So mainly I do functional medicine, which is consults for people. And then I also run a 4-month program.
Okay.
Which can be done in person or online.
And what is the 4-month program?
It's just a structured, more supportive way for people to work with a functional medicine practitioner.
Okay, and is that like diet advice? Is that exercise advice?
Everything.
Lifestyle advice?
Anything that a person would need is incorporated in the program. Because again, everything that I've developed is curated out of what I wanted in healthcare. Do you know what I mean?
Yes.
So, like I said, going to a functional medicine practitioner once, getting a treatment plan, getting maybe even an answer, and then being sent on your way just simply isn't enough for the issues that people are dealing with.
Right. Okay. And so for the 4-month program, is that like a free consultation to meet with you and discuss stuff and then decide how to move forward, if to move forward, that type of thing?
Yeah. So we do a free call, like free Zoom call, where we can discuss the right path for you and how this would benefit you, essentially.
Okay.
Yeah.
And how do people get a hold of you to do that?
You can visit my website or my Instagram.
Always on Instagram, right?
But I communicate with people a lot on Instagram because all my links are there. You can book the free call through there. You can message me, stuff like that.
Most unusual thing that you've seen and dealt with as a functional medicine practitioner? I know I'm totally geeking out on it.
Yeah. I don't know. I see such weird things. I do. I see a lot of weird things.
It's funny while you're thinking about it. So I bartended at the Nest. Love the Nest. And people would ask me, like, you've probably seen so many crazy things, and I have, but it was always hard to like pick one. You know what I mean? So I get it, but I'm sure there's something that.
I just think for me, it's like people come in with these set of symptoms that when you first look at the symptoms, you're like, whoa, this is weird. And how are these all connected? And I'm sorry that you're experiencing this. But I just think for me, the most satisfying thing and interesting thing is finding why they're having these set of symptoms, right? It's like something that they could least expect, or even I could least expect. It's like, yeah, wow, you do have that, and this is what we need to target.
Wow. And so men and women, all ages. What about children?
Yeah. I see lots of kids, more and more kids.
Really? Okay.
Yeah.
Okay.
More and more kids with like metabolic disorders, fatty liver, food sensitivities, skin issues.
Right.
The world's a crazy place.
It is. And like our diets and the way we take care of ourselves or not take care of ourselves is like all over the board.
Exactly.
Yeah. Awesome. This has been super cool. So did I not ask you the right question? Is there anything you want to say further? What would be something you would want people to know?
I just think that, functional medicine is unknown to a lot of people. Like, you didn't know what it was. And it's still unknown to a lot of people who may even have heard the word before. They don't really understand all that it entails.
Right.
So I just want to reiterate that people should educate themselves on it. And again, if you want to hop on a free call with me to do it, you totally can. But it's definitely an investment in your health, but one that is worth it because 4 months out of your whole life to find an answer and a better path is nothing. And
a healthier version of yourself. And probably, if you come in for one thing, there's probably a lot of other little things that are just sort of like eclipsed by that one really big thing. So as you go through the program, I would imagine a lot of that other stuff also gets dealt with.
Yeah.
Because, right?
And your family starts taking on the habits that you're creating. And they're like, you're seeing results. I'm going to start eating this too.
That's right. I love it.
It's like, even if I've never met other family members, I am benefiting them in some way just by helping their spouse or their partner.
Yeah. This has been so awesome, Cleo. Like, I'm super excited. I'm thinking about all these people that I know that I'm like, you have to meet this woman. So I appreciate your time so much, and I would love to hug you if you don't mind.
Yeah.
Thank you so much.
I'm not going to say no.
I know, right? I don't. Thanks again, everybody. We appreciate you hanging out.